Hello, and I want to thank everyone for being here with me today as we talk about protecting and promoting resilience during a pandemic. I am Zach Testo. I'm one of the faculty at Baystate Medical Center. I'm also the Wellness Fellowship Director in a brand new fellowship that Baystate has introduced this year. I did my residency as well as my ultrasound fellowship at Baystate, and I grew up in the Northeast, originally in New York. Now I live in Northampton, Massachusetts. I have been at Baystate for about 6 years, and I am passionate about wellness, that of our residents, our faculty, and that of our department, as well as hospital-wide. So this is a topic that is near and dear to my heart. We're going to be exploring a little bit about resilience and how it pertains particularly to our experience during the pandemic. So without further ado, let's start to move along towards what we know about resilience in previous pandemics. So back in the mid-2000s, there was studies done in Taiwan during the first SARS outbreak. During that time, it was noted that 5% of Taiwanese healthcare providers on the front lines of SARS showed signs of acute stress disorder, which is a precursor to post-traumatic stress disorder. At that same time, there was a similar survey that went out about nurses in Taiwan and found that 11% of Taiwanese nurses showed stress reaction syndrome. Then fast forward about 5 years into the H1N1 epidemic, and we're seeing that some studies were showing 20% of physicians showed moderate psychological distress and 6.8% with severe psychological distress during the peak of the pandemic. So now we're headed, fast forward another few years to 2020. Preliminary data out of China shows that the trend is not over. With SARS-CoV-2 and coronavirus in the world right now, we're seeing similar numbers as far as healthcare workers being close to burnout, with increasing levels of stress, anxiety, depression symptoms, which could later on lead to post-traumatic stress disorder. In an effort to try to bring some more of that to light, we're going to talk about some things related to resilience going forward that hopefully will be in practice at your institution, and we've been trying to put into practice at our institution some ways that we're trying to protect our healthcare workers, including faculty, residents, nurses, everybody. There's this idea surrounding resilience, and we keep trying to put pictures to it or to be able to wrap our minds mentally around resilience. If you're looking at the Venn diagram right now, basically it's putting things into a few categories of what we can call feelings, but really they're emotional categories, including cognitive, physiological, and interpersonal. These are portions of your psyche or your human body, however you want to wrap your mind around it. And then somewhere in the middle where all of these meet, if there's a good balance, then we're considered ourselves resilient. If there's a poor balance, we're considered ourselves in the burnout territory. But what I like to think about and to help me conceptualize resilience is a bucket. A bucket sitting there with enough within it so that when the inevitable leaks come with our job, that we are able to stay afloat. Enough inside the bucket that whenever there are leaks, we can replenish it with more. And the goal here is to not let that bucket level go down too low where we are headed into burnout territory. Sometimes that's easier said than others, or sometimes that's easier said than done, because different people have different size leaks. The leaks come out in different ways, but the thing about a pandemic is now our bucket is leaking all over the place, basically hemorrhaging. And in the setting of hemorrhage, especially in the emergency department, we always think about what are the essentials, what are the ABCs in order to keep our patients alive, and that's what I kind of want to talk about today when it comes to resilience. We're going to be talking about the ABCs of resilience with regards to a pandemic. Now, when we start talking about these things, a lot of these responsibilities fall on that of the institution, fall on that of the administration. And we aren't looking for individuals to be entirely dependent on themselves to create and to foster their own resilience. But the goal would be that your institution would have your interests in mind and your goals would align with that of the institution. So when we talk about the ABCs, one thing that I'm going to be talking about are institutional programs, but also things that you might want to keep in mind as far as priorities for yourself. And if they do align, then making them known to your administration if you feel like those are lacking. So let's talk about the A. A is your ADLs, or your activities of daily living, basic building blocks, and this is the foundation to keep people resilient. These are the things that are often taken for granted or not even really thought about in a normal life that doesn't involve pandemic situations, followed by behavioral health, which can often be neglected and we know is necessary, but now more than ever is probably one of the biggest priorities. And then communication. So ADLs, behavioral health, and communication. Let's start off with our ADLs. The thing that we hear about most often, even in our institution, is PPE. We're talking about protective equipment to be able to shield you from any and all potential contaminants. Now we know that's also easier said than done. Nationwide and worldwide, we're facing PPE shortages, but the administration's responsibility is to keep you as safe as possible. Here at Baystate, we are taking extreme measures and trying to be constantly vigilant about keeping people safe as far as having enough PPE, enough face coverings, enough gowns, enough masks, enough hand sanitizer. But this is just the beginning of the ADLs. This is just the beginning of personal protective equipment. You may hear a story or two about Baystate because we were famous in the news not too long ago, where our CEO, Andy Artenstein, was headed down into southern states to meet a supplier for PPE and being met on a tarmac by federal agents inquiring about how and where and what kind of PPE he was getting, and he had to jump through a lot of bureaucratic hoops. He went to great lengths to be able to get us the things that we need, but it still remains a struggle, unfortunately. But it is absolutely essential. It's the building block of being able to take care of a health force during a pandemic. That being said, there's other things that go along with staying clean and healthy. Adequate shower resources, the ability to get clean scrubs, which we don't even really think about sometimes, and like I said, could be taken for granted in another situation, but it's something that we want to be able to promote here. So we had task force trying to be able to get people clean scrubs and access to them going forward, not just residents, but also faculty, also nurses, and then having good practices about keeping your dirty clothes at work and keeping your clean clothes at home. Never shall the two meet if possible. The ADLs also extend into other areas that you might not think about. So these are things that we, like I said, take for granted, but we want to be able to provide our staff with food and hydration. Where is it going to be found, and where is it going to be safe to be consumed when you're in a busy unit and you're unable to leave for a long time? If you'd like some examples of this, it became really complicated because we did have people in the community reaching out saying, here, let us bring you food. And then it got to a point where, we aren't able to really have community dinner type gatherings because of risk of transmission. It all becomes really complicated, but making sure that you yourself are fed and hydrated during a shift are going to make you more effective for your patients and more effective for yourself. Trying to do it as healthy as possible, eating healthy snacks, and not going on to the relying on the fast food, which can be absolutely the easiest option during a time like this. Transportation and parking. Are you parking in an ancillary lot and then having to take a shuttle in an enclosed space for a while without a mask on? That's something that we need to figure out. So there were a whole bunch of different temporary things put in place, at least at Baystate, but at your institution, you should be asking about the availability of priority parking during this time. Lodging for those who had susceptible people at home, who needed to be isolated, who couldn't risk bringing anything home. That is a major portion of what we try to do at Baystate with having alternate lodging and everything. And then childcare. We want to be able to have resources available for people, and it becomes very complicated if you're having a stranger enter the house Are you having children from other families around your children? These types of things are a logistical nightmare sometimes, so having administration and having some ancillary help to be able to help coordinate these things is essential. Those are your ADLs in a nutshell. I'm sure there's a million more that you could probably tell me, and it really becomes a mental checklist about what you would like and what you think you need during this time. But these are just some of the ones that should come to mind and make sure that you're not leaving home without. Let's move on to behavioral health. So a lot of us in the beginning of the pandemic, there were young, healthy physicians who said, everyone's gonna get the virus, it's okay. I don't care if I get it, I would just feel really bad if I gave it to somebody else. And then there were older physicians who may have had some comorbidities who were fearful that they would actually get it. And there was this general consensus of, I'm very afraid that my staff is going to go under with this. My colleagues are going to be able to, are going to be susceptible to this and go have COVID. And the unifying theme here is there was fear, there was doubt, there was trepidation, and there was stress. And if you think back to that bucket, this stress was inevitable, and this stress was draining the bucket on a daily, hourly, minute-to-minute basis. The hard part about that is these increased levels of stress for months and months on end are a recipe for some bad mental diseases, including post-traumatic stress disorder and, in some cases, depression, which are something that we don't take lightly at Baystate. And one of the things that we accelerated when we first started to deal with this was to get our employee assistance program up and running in full force and to make it completely virtual and digitally available for any employee with at least 8 free visits completely paid for to be able to talk to a therapist and in most cases a prescriber for the mental anguish that is coming with this job inevitably. We accelerated our programs, made a lot more therapists available, and we encouraged our staff to be able to do this. If it wasn't through Baystate, we had other resources that we were trying to get through other healthcare plans, but I would say the behavioral health around here and across the nation really stepped it up as far as being able to do outreach to people. The hard part being that after you've worked 20 COVID shifts and everything seems to be crumbling around you, it becomes one more step that you have to take in order to reach out to somebody. So the other part of what we were trying to get off the ground was a peer support program where we were having direct outreach that was opt-out rather than opt-in. When people were having bad cases, and still to this day, we're having peer support programs that was informal and is now becoming a formal workforce that is trained by folks out in Boston to be able to intervene and to contact people who may or may not be suffering, just to reach out and say, hey, do you need a shoulder to cry on? Do you need somebody to listen to what's going on? And if you do, and we can think of a plan going forward together, this person is trained to be able to link them with resources later on. So the peer support program will continue to get more and more robust as we go along here. It's in its fledgling stages, but I'm really proud of the work that we've made when it comes to that. What I want to talk about next are the burnout domains, and no wellness talk would be complete without our 3 main burnout domains, which include depersonalization, emotional exhaustion, and lack of self-worth. These are the danger areas when you start to talk about resilience, and these are where the bucket starts to get lower than that line and you start to head towards burnout. So think about resilience as keeping us above that level in order to be the anti-burnout. With regards to depersonalization, our institution attempted to create as many social programs as we could. Sometimes it ranged from virtual flip cup to virtual things like Zoom trivia and Zoom Family Feud. The trivia was hosted by yours truly. And we were trying anything and everything to be able to get to people feeling like they were socially connected in a time when we were unable to be physically connected. We had online shares of books to read and TV to watch and binge on Netflix and Of course, we were sharing recipes and everything. We're still trying to do that today, and we have a Google Doc that is continuing to be populated with pictures of people's puppies, as well as good recipes to be able to eat. The depersonalization is just a portion of it is your social milieu that you're in, as far as being able to see your co-residents and your co-faculty. It's an interesting thing being a essential worker, because you actually are at a job where you do have a decent amount of social interaction with colleagues, because you have to be shoulder to shoulder as you do some of the frontline work. But at the same time, you come home and you feel very socially isolated because you're unable to do the things that you were doing before. Depersonalization, only one facet of that is your colleagues. The other thing is your personal connection with patients. In an effort to bridge the gap between the outside of the door and the inside of the patient room, we have a bunch of iPads or iPod touches that are now basically FaceTime machines that we can have face-to-face interviews with the person from across the glass, because what we've lost in a lot of instances is the ability to have that personal touch. Many studies have shown that telehealth reduces satisfaction as far as provider satisfaction, and in our case, we're no different. Our distance from patients could be spurred on by fear of transmission, lack of PPE and trying to preserve it, patients in isolation rooms, and that is a difficult thing to try to navigate when you're used to being at the bedside, sitting there and holding somebody's hand. We're trying our best to bridge that gap by using this virtual thing in the room. It's not the same, but it's definitely better than sitting there completely isolated from somebody. And then at Baystate in general, the use of telehealth has really gone up on the outpatient provider side. For them, they're actually seeing some good results there. I know it's not the same, but we're trying our best here. And then, continuing on, we're out of the depersonalization and now we're into emotional exhaustion. As you can see on your screen, this was a picture that was shared with me from one of my my co-medical student graduates. She's a ER doctor out in Loma Linda, and she gave me this picture saying, with a guy in an ICU room writing on the glass, "Just going to hold his hand for a bit. I don't think he has long." And her caption is, "Who's crying in the break room? Hint, it's me." In an effort to externalize these things, we tried to come up with a wine and cheese club, WHINE, and at journal clubs and at Peace Club for Pediatrics, we would have roundtable discussions and try to externalize all of the frustrations, the fears, the anxieties, and the terrible emotions that come along with being within a pandemic. The important thing being that the externalization of it in front of other people not only helps you to start to normalize it, but it might be something that they are feeling themselves, that they thought they were suffering with in silence because they thought they were perhaps not strong enough, and to hear somebody else say it was important. Emotional exhaustion goes hand in hand with behavioral health, because really it's about building up the mental fortitude to be able to continue on, and having a therapist, having a psychiatrist if necessary, is absolutely integral to being able to do this. So I strongly encourage any and all people working on the front lines to seek help when it comes to that. And finally, the lack of self-worth is the final domain in wellness. Interestingly enough, the word hero has become a bad word for some of us, and it's kind of astonishing to think that, but there's the imposter syndrome and the not wanting to be martyrized, and there's too many things that go into the word hero when it comes to the social aspect of it, that it becomes very complicated in our minds, because if we are losing a battle to coronavirus, then are we really heroes? I think now that we've started to turn around and become smarter and more educated and more successful in being able to recognize and treat coronavirus, I think we're feeling a little bit more comfortable with this, but for a lot of people, there was a lack of self-worth when it came to the ability to fight such a terrible opponent, and to have fighter jets flying over a hospital but feeling like you were abandoned as far as not having enough PPE or enough resources. There was a lot that went into that, and a lot of psychological damage that could come from that. I think we are going to continue to see some of that, but hopefully the lack of self-worth is going to be combated by things like at Baystate, our Baystate Celebrates, and administration recognizing the hard work that we do. It might never be possible to really give it the credit it deserves, but at least we're going to try. And then just as far as behavioral health goes, I do need to mention the concept of protection really quickly. Protection comes in many forms, and it doesn't just have to exist as gowns and gloves. Really what we want to strive for is a society and an administration that protects its healthcare workers from superfluous litigation, from societal pressures, and from its own pressures within from colleagues. Basically, things change a mile a minute during a pandemic, and to know what the standard of care is or if you're doing the right thing is sometimes confusing. It was made clear that we were going to be protected from litigation from the get-go because we were trying our best to deal with something that we had very little knowledge of in the moment, and that continues on. And then protection from the societal pressures is something completely different, but protection from your own colleagues is something that I think Baystate has strived in. We are constantly encouraging our staff, our residents, our faculty to take their own health into account, call out if you're having any symptoms, take your time, and have the slack be picked up by other people who are ready and willing, as opposed to the previous notion that you came to work if you were feeling a little off only because you didn't want to ruin it for somebody else. This shows a lot of maturity on a lot of people's parts, and we're getting rid of the guilt that's associated with taking care of yourself, because this is the perfect time to do it. Finally, our last portion of our ABCs is communication. Communication in all aspects of life is absolutely essential, and here we go. With a pandemic, it is no different. So one thing that I think Baystate did absolutely well was effective, clear communication on a consistent basis through multiple channels. We tried our best to keep up with the mile-a-minute information that was going on, and big credit to Dr. Lauren Westifer, who had a COVID lit update every single day during the peak of the pandemic. She still continues to provide us with high quality, well-researched information in a time when none of us really had the time or the mental capacity to be able to keep up with all the research. She kept us abreast of everything that we needed, so kudos to her. We had a weekly recap meeting, which was every Friday afternoon. We were having our administrators on the phone answering questions, giving us the updates about what was going on, feeding us information from above, and taking all information from below and synthesizing it in an effective way that was clear, and then it was sent out in an email. It was also added to a Google Doc that was ever changing. We had protocols as far as the newest PPE regimens and the newest testing regimes, where to find things. We had our CIS experts like Dr. Bob Bayeski constantly updating care sets and being able to keep us updated with anything where we could find it. So we basically had a multimodal, effective, clear communication for something that was literally like trying to drink from a fire hose. And thank goodness that everybody was on board for that, because we would have definitely been lost, and this could have made our mental health way worse. They were also doing check-ins with us, and administrators were keeping check on anybody and everybody who needed any help. And then they were constantly available, working extra shifts, coming in and just being around and having their finger on the pulse. We had go-to people as far as being able to get us scrub access and to be able to get us food access. There were many different teams built to be able to keep us on the cutting edge and to keep us safe. These are the things that I want you to see in an institution, because it really means that people's safety, health, and education are a priority. And I would say Baystate excelled in this area when it came to the epidemic, especially during the peak, and it continues on now. So let's talk about what the ABCs mean for you. Your goals for yourself, what I would encourage you to do, and this is by no means a complete list, but just some things to think about if you're going to be dealing with your own resilience during a pandemic, is your ADLs. Set a schedule, eat healthy, and make sure that your own PPE and your protection are a priority for you and a priority for your administrators. And don't put yourself in harm's way. If you feel like you're not being adequately protected, you need to have a hard pause and figure out what you can do to change that immediately, and how your work can possibly go on without it is not something that you should be considering. B, behavioral health. Utilize an employee assistance program wherever you are, or if you don't have one, ask why not. Ask your administrators to hook you up with something that's going to be able to protect your mental health going forward. And it's like a muscle. You have to keep exercising it. Look for socialization where available. Things are becoming more available right now as we head into the winter months. Who knows? But we're going to try our best to keep all of our social things available. If it's online, it's online. If it's not, great. And then having a long-term plan, being able to recognize symptoms within yourself is very difficult. So having somebody who can help follow you along and look for any PTSD symptoms later on, because symptoms can linger for years, and a lot of people don't necessarily recognize it within themselves. It takes somebody else to point it out. Finally, C, communication. Check in with your friends, and then check in with yourself. Request information, request access to whatever information channels are available. So if it's going to be an online thing, make sure that you have access to it. If it's something with a password, make sure it's saved within your phone, and keep going from there. Those are your ABCs for building a effective, resilient, professional relationship during a pandemic. I do want to talk about one more thing that's coming to Baystate very shortly and could be available at your institution right now, but will be available to us and is available on the App Store. If you search this on the App Store within your Android or iPhone, it is the Heroes Health Initiative. And basically it is an effort that came out of the University of North Carolina, and it is an app that is sponsored and developed by Google that allows you to go through a series of survey questions each week and start to measure your symptoms of burnout, look for signs and symptoms of depression and PTSD, but also anonymously alert your administration about things like the availability of PPE and how safe you feel on your unit. At the end of each survey, you're linked to some things like employee health services or hotlines to be able to call. And then in certain extreme instances, if you allow the app to do this, they will reach out to you if you meet certain criteria for concerning things like suicidality or worsening depression. And you'll have somebody from your institution that is completely confidential reaching out to you without having to alert your administration or your immediate supervisor. This is something designed completely to be to the benefit of the user, and could also be to the benefit of a administration who can see anonymous data about how they're doing and what they need to do to change. So take a look for that if you're ever curious about that. Heroes Health Initiative on the App Store. Resilience, if you want to think about it as a bucket or whatever you want to think about it as, is something that we have to all work on and is not coming inherently to necessarily anybody. It is something that we need to help to foster, and it is a concept that sometimes gets neglected. I also don't want this to be anything that's put on you. You need to ask only that other people in your administration, your institution, are there to help make sure that your bucket is full enough. So if you have any questions, please feel free to reach out to me. I'll have my email available in the credits of this YouTube, and I really appreciate you, all of the people in the room, really, all of our wonderful attendees, and anybody who's watching this. Thank you so much for learning along with me. I really appreciate it. Have a good one.